Your gastroenterologist found nothing. Well, because he's looking in the wrong place, right? You had an endoscopy, you had a colonoscopy, everything came back normal, but your gut still doesn't work right. And that's because your GI doctor is looking at structure when the problem is function. I want to explain that gap. A colonoscopy is going to show polyps, tumors, ulcers, strictures, structural or abnormalities. It doesn't show what your microbiome looks like. It doesn't show if you have SIBO. It doesn't show if your gut lining is permeable. It doesn't show if you have pancreatic insufficiency or bile acid malabsorption. Your gastroenterologist is trained in pathology. If there's a lesion, he can see it and biopsy it, and that's important. But most gut dysfunction isn't about lesions, it's about microbial imbalance, enzymatic deficiency, motility disorders, and immune dysfunction, especially in the gut lining. So we see this pattern constantly. Patient has bloating, diarrhea, constipation. They have food sensitivities. They spend $5,000 on scopes and imaging. Everything's normal. So your doctor says it's IBS, and then you get handed a prescription for some antispasmodic, and then they tell you to manage stress. But when we actually look and test their stool, a proper stool analysis, comprehensive diagnostic stool analysis, not the silly thing they do at the lab at your doctor's office. It's just not enough information. So we look at the bacterial diversity, we check for parasites, we measure digestive enzymes, we assess inflammatory cytokines and inflammatory markers, and we find the problem usually pretty quickly, right? So we find it immediately. Dysbiosis, low secretory IgA, opportunistic infections going on, fat malabsorption. Oh my gosh, all this stuff happens all the time. We see it all the time. So if your gastroenterologist told you everything looks fine, but you're still miserable, the scope didn't fail, the diagnostic paradigm is what failed, right? So functional testing will find what imaging can't. Find somebody who can test you properly.